Well, obviously, molecular testing is very important in the management of modern day oncology. So there are a number of particular patient populations where finding a particular molecular marker is really important to determine how well a patient might respond to treatment. Common examples are EGFR mutations in lung cancer, obviously now BRCA mutations in potentially in ovarian cancer and in potentially in breast cancer, and then things like MGMT status, and all these different molecular markers help predict sensitivity to treatment, and so clearly it's very critical that we've got assays that are fit for purpose to identify all those. Well, it's a good question, and interestingly, even though radiotherapy is used in over 50% of patients who, at some point during their cancer treatment, there aren't really any markers that we can use to predict how well patients will respond to radiotherapy, and also which patients might get worse toxicity than others. So I think there's really is a really great unmet need in radiation oncology to identify molecular markers that we could use to identify patients who are likely to get worse toxicity and patients whose tumours may respond better to radiotherapy than others. Because at the moment, when a patient comes for radiotherapy, they'll get the same dose. All patients with a particular type of brain tumour or a particular type of lung cancer will all get the same dose, irrespective of the molecular and genomic makeup of their tumour. And I think going forward, now that we have what are called next generation sequencing platforms that allow us to do multiple gene testing at a relatively reasonable cost, that if we're able to implement that for radiotherapy in large cohorts of patients, over time we'll start to gather a lot of data about a patient's molecular profiles, be able to marry that with their clinical outcomes, and then hopefully identify molecular markers that might be useful in the future. So I think from a radiation oncologist perspective, we all know that treating all patients with the same radiotherapy dose may well not be the right thing to do, and finding ways to identify patients who may respond better to radiotherapy and therefore could have a lower dose and have less toxicity from treatment would be helpful. Identifying patients who have really very radiation resistant tumours because of a certain molecular marker, where in those patients we could perhaps give them a higher dose, or even think about alternative treatments altogether. So I think being the radiation oncology being more informed about molecular profiling of patients, molecular diagnostic, and how that links to outcome will help us to use radiotherapy, which is a very precise treatment in terms of the delivery of the radiation treatment, in a more precise way when it comes to identifying patient populations within our generic cohorts of patients. Well, interestingly, I think the radiotherapy patient population per se doesn't have as big a sort of advocacy movement as other tumour types, for example. And so I think there's probably a lack of understanding with patients about the lack of utility of molecular diagnostics in radiation oncology. And so I think certainly, hopefully greater awareness by patient and patient groups, hopefully we'll be able to put pressure on healthcare providers across Europe to try and implement these sorts of tests so that we could gather this data. So unfortunately, as there's no immediate patient benefit from doing these molecular diagnostic tests in a radiation oncology radiotherapy group of patients, it's difficult for healthcare providers to justify the expense of that. However, clearly there's a potentially huge benefit from having this information and identifying those markers that would really benefit patients in future. So hopefully, patient advocacy groups or patients themselves can help lobby to try and apply the concept of molecular diagnostics to the field of radiation oncology. The challenges of this sort of testing in cancer care goes across other areas of cancer medicine, not just radiation oncology. And that includes a lot of logistical things. So for example, often we can only get small amounts of tissue from patients having cancer therapy, such as biopsies, and being able to use that material to its fullest extent can be quite challenging. Some of these more complex molecular diagnostic assays do require sufficient material to do them. Also, I think across Europe, the other challenge is that the platforms that we'll use for these sorts of molecular diagnostic assays are quite disparate, and I think there are opportunities to unify these things so that we can merge data together and hopefully learn more about the patients that we're treating.